Screen shared here. So I first want to acknowledge that Alberta is the traditional ancestral territory of many peoples, subject to Treaties 6, 7, and 8, namely the Blackfoot Confederacy, the Kainai, the Piikani, the Siksika, the Cree, the Dene, the Saulteaux, Nakota Sioux, Stoney Nakoda, and Tsuut'ina Nation, and the Métis people of Alberta. And that includes the Métis settlements in the 6 regions of the Métis Nation of Alberta within the historical Northwest Métis homeland. And there's many First Nations and Métis and Inuit who have lived and cared for these lands for many generations. And I'm grateful to live on these lands. So a little bit about myself. As Dawn mentioned, I'm the Director of Professional Development for the Alberta Pharmacists Association. I worked for many years as a hospital and part-time community pharmacist. I worked about 20 years as a hospital pharmacist specializing in addiction and mental health. And then I left to go work for the Alberta Mental Health Board as the Director of Telemental Health, and then moved on to Alberta Health Services Provincial Addiction and Mental Health team, where I ran a research program in addiction and mental health. And a lot of the research that we sponsored related to climate and mental health because we had a number of climate-related incidences that were quite severe in Alberta, forest fires and floods and so on. So it is certainly an area after my heart for sure. So here are my disclosures. I don't have any relationship with commercial entities. And I think the most important one is that I'm a hugger for sure. That's 100% of the time. Not always a tree hugger. Sometimes I'm a tree photographer. And this is a photo I took of a heritage tree in the community that I live. It's along the river bank in the river valley. Sorry. So the learning objectives are that hopefully you can describe how climate change can affect mental health and maybe be able to have some knowledge about some resources that you can support your patients. So I went to Dr. Google and I said, what is climate change? And in 0.63 seconds, I got over 1 billion answers to that question. So that really shows the magnitude of the importance of this issue and the interest that people have in it. So I decided that I liked the United Nations definition of climate change the best personally for me, because it talks about a balance between natural causes and human activities. So that anthropogenic causes, that human thing contributes as well. So we have seen a lot in the news, and I just picked out a few headlines, North American headlines about, flooding. I found about Ontario maple syrup producers blaming climate change, about tracking wildfire smoke. In the middle, I put just some headlines from the UK, and of course, they just boil it down to 2 words, code red mostly. And then in the bottom there, the climate change poses long-term threat to Canada's security. And so the Canadian Security Intelligence Service, or CSIS, recently talked about some looming dangers in the Arctic and the coastal and border security because of pressures on food and water supplies, about how rising water could damage our infrastructure. And there's modeling that shows that could be potential loss of coastline in BC and in the Atlantic provinces due to rising sea levels and flooding, a loss of biodiversity and habitat, so that we could have more interaction between people and wildlife, and that can increase the risk of animal-borne diseases to humans. The loss of arable land, so that puts more stress on agricultural resources, and freshwater resources will shrink, and so that water might be a really vital and contested commodity sometime in the future, and that's the CSIS viewpoint on climate. So what about the healthcare system? Well, I looked a little bit at the national healthcare system in the UK, and they talked about having about 4 to 5% of their greenhouse gas emissions, so their carbon footprint is related to healthcare. The Dutch system is about 4 to 8 in their estimation, and in Canada it's about 4.6%. So there was a recent headline that said that Scotland banned desflurane, which is an inhalation anesthetic. And interestingly, an hour of use of desflurane is about equivalent in emissions to driving 320 kilometers in a car. So they switched to the injectable sevoflurane anesthetic, and that's equivalent in emissions to only driving about 6 kilometers. So anesthetic gases make up about estimated 2 to 5% of the national health system in the UK of their carbon footprint. About 4% are asthma inhalers, and they also are looking at things like travel, powering of buildings, and so on to make some changes. In Canada, we've been focusing a bit more on reducing waste and reliance on single-use products. Of course, looking at changing to more virtual care options. And of course, what we hear a lot about now is metered dose inhalers. And if you haven't gone to a presentation about metered dose inhalers, I encourage you to do so. It's kind of alarming when you learn about the impact that they can have. I'm very proud of the Alberta Pharmacists Association. For over 20 years now, we've had an Envirex program where we help pharmacies safely dispose of extra and unused pharmaceutical products. So what about the climate change influence on health? The World Health Organization is projecting lots of things because there are well understood impacts of climate change. And I picked out a few of them to talk about. So vector-borne diseases. So we know that mosquitoes can carry disease, and so changes in the water. We can have other waterborne diseases as well. There is some indication that we've got some favorable conditions in some of the natural waters on Earth that will help increase the amount of cholera, even though we know unsafe water is usually what the cause is. In terms of respiratory issues, we've got things like pollution and smoke. Definitely we all know about morbidity and mortality due to weather events. We see that quite a bit on the news. And of course, mental health. And in this case, mental health refers to not just mental illness, but problems in terms of your general state of mental wellness, emotional resilience, your psychosocial well-being. And I'll talk more about that here shortly. We also have indirect health implications of climate change, and those are things like illness related to food and water safety, undernutrition related to food insecurity. So we've got changes in the season length for growing crops, changes in food production, changes in food supply. So all of those things can lead to undernutrition. The next one, the malignant melanoma from UV exposure, I think that's something that really pharmacists can easily intervene and educate people on use of sunscreen and safe exposure to sunlight. And chronic kidney disease from dehydration. And that dehydration can occur from excessive heat or potentially even lack of access to clean drinking water. Now, lived experiences of climate-related harm also produce impacts, and really these impacts can be more severe. And certainly at my time with Alberta Health Services, we did lots of research looking at the results of, for example, the Fort McMurray fire, where an entire city had to evacuate. And there was a lot of mental health issues as a result of that, especially PTSD, anxiety, and so on. So we know that your physical health and overall well-being can be affected by experiencing climate-related trauma. But there's many different things, like the lack of access to medical care or proper food. You know, if you're diabetic and you can't access the proper food or your medicine, that's definitely very significant. And of course, your emotional and mental well-being. And so for sure you're going to feel sadness, possibly depression, and it can even continue to suicidal ideation. If you think about, you know, I think I live on the prairies. If you farmed or were a rancher and all of a sudden, you know, you couldn't use your land or your cattle died, you know, and then you couldn't provide for your family, you've lost your livelihood, and that could potentially make people suicidal. We have, of course, existential threats. So you know, you don't know what's happening, you're overwhelmed, and you've got a lot of anxiety. And of course, trauma if you witness things related to a climate event. And human mobility, and this is something that CSIS also commented on, that there could be a lot of different kinds of migration, forced migration, because of the effects of climate on people's homes. And it is documented that some of that human mobility and forced migration causes an increased alcohol consumption and violence as well. And some of those things can also influence your health. Now, I picked out a Leger poll that was in October, and I got little arrows with Ontario and Alberta. And they had, it's a small sample, but they asked to what extent you're worried about climate change. And in this poll, 45% of Albertans and 54% of Ontarians said that they personally experienced the effects of climate change where they live. So that's almost half the people sampled. 50% of Albertans believe climate change is caused by human activity, whereas 67% of Ontarians, 33% of Albertans, and 20% of Ontarians believes it's caused by natural causes. So there is some difference regionally, and that to me isn't actually very surprising. So what about the media? What does the media say? Well, there's a lot of alarmist and apocalyptic tones in climate change reporting. If you look, there's words like terrifying, unnerving, critical, catastrophic. And so you hear those things, and that can potentially increase your fear about climate change, and that can also potentially increase strong emotional responses, and maybe that leads to anxiety as well. I had to throw in the toxic forever chemicals found in toilet paper because we just got out of the pandemic and a lot of issues about toilet paper, and here we are again hearing about it. So what about mental health and climate change issues? Well, there's lots of research that's starting to be done now on mental health. It wasn't a big issue, or it was maybe less focused on before. We focused a lot more on physical health things, but less so on mental health. But the research has shown that the marginalized and vulnerable populations are often disproportionately affected by climate change issues. So that kind of makes sense in that the marginalized and vulnerable populations might have more food and shelter insecurity, they might have more poverty, substandard housing, homelessness, no access to things like air conditioning, they might be socially isolated, they might already have mental health issues. So it does make sense that those populations could be affected more. Indigenous people may be more strongly affected by climate change ecological breakdown. Obviously, we've got many Indigenous people that live off the land, and so their livelihood could be affected. There was a study done in 2013 about the Canadian Inuit, with the Canadian Inuit, and climate change was linked to reported increases in substance use and suicidal ideation. Older people, women, and religious and ethnic minorities are more at risk as well. Women in some cases have more pre-existing inequities such as poverty, unequal access to resources and education, disproportionate care responsibilities, and elderly people might have more physical impairments or social isolation, advanced age that make them more vulnerable as well. And there's been an increasing amount of research looking at young people being more prone to anxiety and depression and stress and sleep disorders, cognitive issues related to climate change. Also, the increased temperatures, the heat waves and humidity have definitely been linked to worsened mental health outcomes and suicidality. When you're in heat, you might be more uncomfortable and irritable. That can lead to more aggression. Men in particular in research have been found to be especially sensitive to the effects of heat and become more aggressive. Altered behaviors in heat can change things. So we might all congregate where we find relief from the heat, but then maybe that congregation can cause more aggression as well. Increased use of alcohol. You're hot, you're going to drink a beer to cool down, and that can cause more issues as well. It's also been shown that the heat can increase the risk of suicide, independent of other factors. With mental illnesses that you already have, like schizophrenia, you can get an exacerbation of that and increased mortality related to heat. People with dementia can become more agitated in a hotter atmosphere. And of course, we all know it's hard to sleep, and you can have insomnia with heat. So that can certainly influence mental health as well. There's indirect causes, of course, and I kind of talked about this already, about the disruption of food supply and the stress that puts on families. And of course, migration, which I talked about a little bit as well, and that could cause more stress as well. And as can remaining in areas of conflict that have been affected by climate. So our changing climate has caused some emerging concepts, and these are really terms that psychologists have developed. And the first one is climate change anxiety. And so that's the distress and worries about the effects of climate change. The next one is solastalgia, and this one was sort of a combination of solace and nostalgia, and it's really that distress caused by environmental change, and that environmental change is in your home, and so you see what's happening to the climate and the environment around you, and that feeling they've termed solastalgia. Eco-anxiety is a chronic fear of environmental doom, and ecological grief is that grief felt when you've experienced or there's anticipated ecological losses. So the landscape's changing, the loss of species happening. So worldwide, there really is an increase in that ecosystem distress syndromes that I've described, and that correspondingly increases the human distress. And kind of this grouping of these terms are called psychoterratic syndromes. And so it's important to acknowledge, though, that emotional responses to climate change are not based necessarily on direct experience. So we may not have had a severe experience with climate, but they are mediated by our social context. So the risk of people developing these syndromes is really a bit subjective, and sometimes can vary between cultures. It's not an official reference point in the American Psychiatric Association's Diagnostics and Statistical Manual of Disorders, which we call the DSM-5. There is no specific diagnosis listed in the DSM-5, and I think it's important to think about whether we really want to pathologize climate anxiety. Is it really a mental disorder? Or is it just a general feeling of anxiety that many of us feel, and it is not severe enough to be listed in the DSM? So it isn't yet, but certainly we know that these feelings of anxiety and grief are prevalent across the world. So I know I talked a little bit about children and the severity. So this study was done by some Canadian researchers in Alberta and Ontario, and they examined the impact of climate change awareness on children's mental health. And so they just were doing a scoping review to identify areas of further research and kind of summarize what was out there. So there seems to be an awareness in children about imminent threats to the planet. And so climate change does impact children's mental well-being and their emotions. Most of the studies that showed negative emotions were from high-income countries. So most of the research that they looked at was from Europe, Australia, and North America. And the anxiety and worry related to climate change awareness was prevalent in many of the populations that they looked at, of populations of children, but it wasn't a homogeneous way of measuring it. So I think that kind of tells us that it exists. We don't know necessarily the degree of the anxiety and worry because we can't really compare it, and that probably is an area of further investigation. So, what are some of the signs of eco-distress and anxiety in young people? Well, anger, frustration, feeling anxious, hopelessness, trouble sleeping, irritable, upset. And then, of course, if children have had specific interaction with a climate disaster or emergency, climate trauma, I'll call it, they can have impaired emotional regulation, learning or behavior problems, and potentially even mental health problems later in life. If you're at all familiar with Vincent Folletti's study, the Adverse Childhood Experiences study, that study showed quite clearly that trauma in childhood can result in physical and mental health issues later in life. So that's not surprising to see that. Now, in Canada, we did have a study. That study was a little bit of Canadian and Australian children. There was one study that looked at sort of more younger people or young adults, ages 16 to 25. 1,000 of them were surveyed about their feelings about climate, the government, support, resources, climate anxiety, and so on. And of that 1,000 young Canadians, 76% thought that people have just failed to take care of the planet. 39% are hesitant to have children. 71% were angry at the government and their inaction on climate change, or what they felt that to be. 69% of them felt abandoned. 6 of 10 thought that there should be more information in our education system to teach them about climate change. And 78% reported that climate change impacted their overall mental health. 78%, that's very high. 4 in 10 said that their feelings about climate change negatively affected their daily life. So that's really, really significant. So I'm just going to lay that out there. Of the Canadian youth in the previous study I mentioned, 48% think humanity is doomed, and 73% find the future frightening. So there's many young people who believe that the world might end, or they're very, very frightened by the issues in climate. So it's not surprising at all that we have things like climate anxiety happening. So what can we as pharmacists do to help our patients that may be suffering from anxiety and mental health issues related to climate? Well, I think the first thing is really just being aware now that climate can influence mental health. We can think about considering climate-related anxiety, depression, PTSD, any of those things as something that you do as part of your assessment or checklist or tools that you use for assessing patients. You can pay special attention to the patients that you might have that if you know they've been affected in some way by climate disasters. Maybe you've got some refugee or immigrant patients that climate may be a contributing factor to their mental wellness. And I think it's important to get comfortable with asking about the risk of suicide, because it might not be something that is necessarily something that people might want to talk about. Learn where to refer patients for mental health treatment or support. This, I think, could be a really good project for students. If you have students, get them to create a little list of your mental health agencies, helplines, community programs, online resources. I had a student do this, and it's something that maybe you can put into their bags with their prescriptions, or have them waiting on the counter. And people then, maybe if they're uncomfortable asking for help, you're kind of giving them a little bit of assistance anyway by having the information readily available for them. Consider how climate can affect medication use or side effects or adverse effects. So because I worked in mental health, I always think about my patients that are on antipsychotics, that their thermoregulation system is affected by that. So they have a lot more difficulty in heat and can overheat more easily. So if we are experiencing high temperatures, those patients specifically might need more education about being safe in high temperatures. You can also consider asking some questions from a validated questionnaire. In the slide deck, I do have some resources listed with links to questionnaires like the PHQ-4, PHQ-9, the GAD, the Climate Anxiety Scale. You may not feel comfortable, and I'm not expecting you to feel comfortable asking them the full questionnaire, but maybe look at them, and maybe there's one question you can pick out that might you can add to some of your assessments. I think also it's important to remember that pre-existing mental illness also triples the risk of death in heat wave exposure, and that's also people with psychosis, dementia, and substance misuse. So that bear that in mind as well. I think it's important to educate yourself on steps that you can do to minimize your pharmacy's impact on the environment, because sometimes people are really anxious about climate change and feel like nobody's helping or there's nothing we can do about it. So it might be a good sense of relief that they might feel if they know you're doing something about it as well. Sometimes we discuss diet with our patients, and people might make choices to change their diet because of their worry about climate change. You know, we hear lots of people about becoming vegan and vegetarian. Maybe it's because they have some anxiety. Educate parents or caregivers about anxiety and the signs and symptoms when you have the opportunity and it's appropriate. You can take a psychological first aid course. I did take one when the Fort McMurray fires came along because we were dispatched in lots of different places. It's available from the Red Cross. There's lots of different places you just can look it up. You also, after you've done, you can get an app for your phone so you can always have it with you. Practice trauma aware or trauma informed care because people may have trauma related to climate change, and make sure that you try and validate their concerns. I hear you, you know, I understand. So in summary, I think it's important to realize that whether you believe in climate change or not, your patients believe what their patients believe can affect their mental health. And there's lots of different ways you can try and support your patients that are experiencing climate-related mental health issues. But finally, I think it's really important for you to look after your own mental health. We have had, as pharmacists, a very, very stressful time during the pandemic, and we can't help anybody else if we don't help ourselves first. So just to note that there are some resources for patient support that I've listed here and some scales. Just a note, there is a climate aware therapist directory. It's a psychologist in North America. And so it lists psychologists that specifically have experience dealing with climate related mental health issues. If you want to do more reading, the Lancet has as a report. It's a little bit long, but there are some specific boxes that are more key points. And so if you have any questions, I'd be happy to answer them.
It seems like there are no further questions. Once again, this will all be made available on the OPA website. If anyone does have any questions for Heather or just regarding Coliform, you can send us an email at education@opatoday.com. I would like to send a huge thank you to Heather for joining us today and sharing all of this information. And I'd also like to thank Coliform for sponsoring this program today. And with that, I'd like to say thank you and everyone enjoy the rest of your day.